Hello, my name is Juliana and I'm reporting live from my basement. How often do you hear of cuts and lacks of funding for citizens of Canada on healthcare? The wait times have gone through the roof for any medical service, procedure, or surgery due to the lack of funding and staff. How often do you hear of drug busts, drug violence, deaths? Drugs and violence is what corrupts cities, communities, peoples, and families all over the world. In Alberta, deaths from overdose doubled since 2015. Ontario in 2017, from January to October, had 263 opioid overdoses, going up from 186 for the full 12 months the year before in 2016. There are many levels and organizations that are set up within the province to help this phenomenon. A lot of money is already going and spent. Ontario has dedicated additional $222 million to educate the health professionals and the general public about opioid, drug crisis, and services available. Something is clearly has to be done. Safe injection sites should not be funded by Canada Health Act. A lot more research has to be done to determine if the money is spent well, where is it going, and is it actually making a difference. It might seem like a lot, but it's a fraction of other causes of death, which should be addressed primarily and funded by Canada Health Act. Studies show cancer is responsible for more than 50% of the deaths. That is a scary number, and with cutting costs to the healthcare, we really need to decide what's necessary, where the money is going, and who's paying for what. Police and drug departments should be invested in. Perhaps as there's less drugs on the streets, less people will be dependent on them. Drugs put a very heavy input in the economy, and many cities is dependent on it. And it's hard to stop when the wrong people are getting paid off. I get it. Fun fact, Pablo Escobar was a Colombian drug lord. His drug organization smuggled more than 80% of the cocaine supplied to the general public. His personal income sits at a $21 billion a year after paying his employees and paying everyone to blind eye. Now let's compare it to the highest CEO at $24.7 million in personal earnings and the highest paid athlete, Cristiano Ronaldo, sitting at little $93 million a year. Now that's a hefty difference. More money can be spent to fund clinics such as mental health and homeless aid to avoid the reason a lot of people are actually turning to drugs. Also boost the funding for rehabilitation facilities instead of clean drug paraphernalia. Studies show that problems such as increase in homeless issue, drug use, and secondary diseases from drug side effect use is the root problem, maybe perhaps caused by mental illness or depression. Harvard review outlined that in order to solve the problem, you have to concentrate on the long-term fix and not the short-term fix. And you have to prevent it from happening on an ongoing basis. So why should those who made an illegal choice be exempt from the law? And can we as a society provide a better solution?